Is cold plunge therapy actually good for you? Doctor explains the science. Cold plunge therapy has taken over social media. Everywhere you scroll, someone is dipping into freezing cold water, claiming it changed their life. From improving mood and muscle recovery to boosting the immune system and increasing metabolism, the list of supposed benefits is endless. But is this really backed by science, or are we plunging headfirst into yet another health trend? Let's talk about what cold plunge therapy really is. Also known as cold water immersion or cryotherapy, this practice involves submerging the body in cold water, usually around 50 to 59 degrees Fahrenheit, for a short period, typically 2 to 10 minutes. It can be done in ice baths, cold tubs, or natural bodies of water. Some enthusiasts do it daily, even multiple times a day. So what happens when you dip into ice-cold water? Your body experiences an immediate stress response. Blood vessels constrict, your heart rate increases, and your body goes into survival mode. This triggers a cascade of hormonal changes. Adrenaline, noradrenaline, and cortisol surge. But is this bad? Not necessarily. In fact, this acute stress is part of why cold plunges are believed to have beneficial effects. Let's explore the scientifically supported benefits first. One of the most well-documented effects is reduced muscle soreness and inflammation. Cold immersion has been used for decades by athletes after intense exercise. It works by constricting blood vessels and reducing blood flow to inflamed tissues. Intessa. Once you warm back up, circulation returns, helping flush out waste products and reduce swelling. A meta-analysis published in the British Journal of Sports Medicine found that cold water immersion can modestly reduce muscle soreness 24 to 96 hours after exercise. So there's a clear benefit here, especially for recovery. What about mental health? This is where things get fascinating. Cold exposure stimulates the release of norepinephrine in the brain, a neurotransmitter associated with alertness, focus, and improved mood. There are even small studies suggesting cold water immersion may help reduce symptoms of depression and anxiety. One theory is that regular exposure to discomfort builds psychological resilience. Another is that cold therapy activates brown fat, which helps regulate body temperature and is linked to improved metabolic health. Wim Hof, one of the most vocal proponents of cold exposure, claims that it can strengthen the immune system. Interestingly, a 2014 study from Radboud University in the Netherlands tested this. Participants trained in cold exposure and breathwork were injected with endotoxins, and they mounted a significantly stronger anti-inflammatory response compared to the control group. While impressive, it's worth noting that this was a small, highly controlled study, and results haven't been replicated on a large scale. Now, let's address the claim about fat burning and metabolism. Cold exposure activates brown adipose tissue or brown fat. Unlike white fat, which stores energy, brown fat burns energy to generate heat. This thermogenic process helps maintain body temperature. Studies have shown that cold exposure can increase the activity of brown fat and may modestly increase calorie burn. However, the effect is not dramatic. You're not going to lose 10 pounds from a few ice baths. At best, it's a supplementary tool. Another interesting claim is that cold plunges boost willpower and discipline. There's some truth here. Repeatedly doing something uncomfortable can train your mind to tolerate stress. In psychological terms, it's a form of hormesis, where small doses of stress make you stronger. Think of it like weightlifting for your nervous system. Many people report that cold plunges make them mentally tougher and more emotionally balanced. Let's also consider the cardiovascular effects. Still, the natural dopamine release could be a valuable tool in a holistic mental health strategy, especially for people dealing with burnout, fatigue, or brain fog.